My name is Dexter Russell Sr., pastor of the North Ramsey Street Church of God, and you're listening to Wake Up.
Evangelist Tammy Fuller from Word of Life Tabernacle Church, 5628 Nicks Road, Fayetteville, North Carolina, and I'm glad to be a supporter of the Wake Up Coalition.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to the pre-Valentine's Day edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. And as you know, February is Heart Month. Not only is it the romantic, soft and squishy Heart Month, it is also the month about real hearts, the hearts that keep you living. And we're going to learn today how to keep them healthy. And we're going to especially talk to the women today. We have some health experts with us in the studio. First, we have a cardiopulmonary rehabilitation nurse. We also have an education coordinator for cardiac services with us today, as well as a heart doctor. Now, ladies and gentlemen, before we get started, please remember that this broadcast is not a time for you to self-diagnose, especially with what we will talk about today. This program is for informational purposes only. Now, if you find yourself maybe you or a family member, this is something we're experiencing. What I want you to do is find yourself a healthcare professional. So, ladies and gentlemen, I want to share something with you. Did you know that according to the Centers for Disease Control website, over 60 million women, that's 44% in the United States, are living with some form of heart disease. Heart disease is the leading cause of death for women in the United States, and it can affect women at any age. Did you know that in 2021, it was responsible for over 300,000 deaths of women? Now, if you break that down into statistics, that's about 1 for every 5 female deaths. Research has shown that only 56% of women in the United States recognize that heart disease is the #1 killer. So, ladies and gentlemen, please welcome and please join to the broadcast Cardiopulmonary Rehabilitation Nurse Genavie Ahmad. We also have with us today Education Coordinator for Cardiac Services, Ms. Rachel Thurnher. And we have with us today Dr. Brenda DePaola. And Dr. DePaola is from Cape Fear Cardiology Associates. Ladies, welcome to the broadcast.
Thank you.
Thank you, Omega.
Dr. DePaola, we're going to start with you.
Sure.
Are women more likely or less likely than men to have heart disease? And if so, why is that?
Well, honestly, it's an equal offender in both sexes. It's the #1 killer in women and men. It's just, unfortunately, oftentimes women don't recognize it as quickly as men because they have other distractors taking away from what's really important, which is their health.
Dr. Ahmad, Dr. Ahmad, I'm moved you up to a doctor.
No, I don't have that schooling. No, ma'am.
Miss Ahmad, how common is heart disease in women?
I mean, it's very common. We see it more so in like the older female adult. After menopause is when our risks are equal with men's. So after usually like 65 or so is when we try to see kind of that increase in risk for heart disease in women.
What about women's outcomes? Are they statistically different than men's?
I think that there are times where the statistics show that women don't fare as well about a year out after an MI, for instance. And the reason for that, I mean, sometimes they don't get the same guided medical therapy. The reason behind that, I'm not quite sure why there's not a lot of research that I could find that could explain that.
Right. Dr. DePaola, let's talk about symptoms.
Sure.
When I was diagnosed with coronary artery disease, mainly because of lifestyle choices, I'll go ahead and admit that, I did not have the same symptoms as my late husband did. He had pressure in his chest. He had shortness of breath. Me, on the other hand, I had a lot of heartburn. I was tired all the time. But like you said, I brushed it off as being overweight because I was tipping the scale at 200 at that time.
Sure.
And eventually, that's when I learned that I had 95% blockage in my main artery. Now, knowing this, will you please tell our listeners and our viewers the symptoms are not the same in men and women, and also, if you have time, or if we have time, which we do, talk about all of the symptoms and who is more likely to have what?
So I think both sides. You have chest pain, you have shortness of breath, you might even have some pressure. And we see that pretty commonly in both sides. The big thing is reduced exercise intolerance, fatigue, nausea, maybe even some back pain. Not lower back pain, but I'm talking like in between the shoulder blades. Those are all sort of the more atypical sort of symptoms that one can identify. I think, however, again, not to put too much on this, but I think it's super important to understand that although the symptoms often are similar, I think because we as women often don't identify that we are just as much at risk for heart disease as men, we sort of just blow it off as, oh, well, let me just take another Tums, it'll go away.
Yeah.
Or, maybe I'll get an appointment, but then something comes up and you don't make that appointment. So I think oftentimes we don't recognize that we too are just as vulnerable as our male counterparts. We just don't seek the care that oftentimes what we should.
You just put my business all in the streets. Ms. Thurnher, how are women's pains and complaints perceived? And what I want to really know is, does that play into any of the problems that you see in heart diagnosis?
Sure. So we know that there's a gender bias in healthcare. When women go to their providers and say that they're having pain, oftentimes this is dismissed. It's not taken as seriously as when men complain about it, unfortunately. Women are sometimes seen as emotional or just being overly sensitive, so they're more likely to have sedatives and anti-anxiety medications prescribed to them rather than actual analgesics to relieve the pain. So if you think about that, them not being taken seriously, that's going to lead to delays in diagnosis, proper diagnosis, and thereby possible treatment delays as well. I know some years ago there was a study in the New England Journal of Medicine that found women were actually 7 times more likely to be misdiagnosed and discharged during an active heart attack than men. So that's pretty scary, and obviously delays in diagnosis, delays in treatment are clearly going to lead to worse outcomes for women.
Wow. Ladies and gentlemen, we're celebrating Heart Month on Making Rounds Live. Not the romantic kind, but the real heart. And if you want to join in on the conversation, what you can do is give Miss G a call at the front. And the reason why I call her Miss G is I can't remember if it's Glenda or Gloria, but anyway. And you can give her a call at 910-483-6111. And if you want air, you can go on the air. If not, she will get the question to us, and either way, this is a beautifully spirited lady, and she will make sure that we get that question answered for you today. Our guest on Making Rounds Live, Cardiopulmonary Rehabilitation Nurse Genavie Ahmad. We also have with us today Education Coordinator for Cardiac Services, Rachel Thurnher, and we have Dr. Brenda DePaola from Cape Fear Cardiology Associates with us today. Ladies, let's talk about women's health complaints. We basically hit on that, but I really want to know that, how can I say this? Getting them to take it seriously. Is that a problem that we've been basically, like Rachel said, forever? Now, Dr. DePaola, I really want our listeners to hear this. What if a woman has the symptoms and thinks that her heart needs to be checked out, but as Rachel said, the doctor isn't taking it seriously? I know what I would say, but I also know that's not a medical answer. So, Dr. DePaola, how should we handle this?
So, as a physician, I make it my personal goal to get to know my patients and establish a relationship with them. And I think as a patient, you want to be able to find that medical provider that is actually going to take the time to sit and listen to you. I kind of use the example, when you come to a new city, how many hair people do you go through before you find that right person that's going to listen to you as to how you want your hair done? Maybe 2 or 3. Mm-hmm. They don't have a problem going and finding another person to do their hair. So if you aren't finding that right connection with your provider, you have every liberty to go find somebody else that might suit your needs better. Now, with that also being said, sometimes it's very difficult to get in with a new primary care provider. Mm-hmm. With the exception of a VA patient or a TRICARE patient, most medical insurances allow you to do self-referral. So if you don't feel like you are being appropriately attended to by your primary care provider, then you can pick up a phone and call a local cardiologist, and they can make sure that you get seen in a timely manner so that they can address some of your additional concerns that maybe otherwise were brushed off.
Telemedicine, this is a question that just came to mind. Telemedicine is a big thing right now. Is telemedicine something that you would suggest contacting regarding the heart, or physically go into the doctor's office?
I'm not a big fan of telehealth medicine when it comes to cardiac-related issues because I can't take vital signs at a telehealth visit. I can't get an EKG at a telehealth visit. I can't do a physical exam on a telehealth visit. And so those are very important parts of what I call a complete and thorough medical examination. So it might be one of those things that you can initiate with your primary care provider, but when it comes to actually sitting down and getting, no pun intended, to the heart of the matter, you actually have to have someone physically sit and take a look at all the pertinent features of that physical exam.
Dr. DePaola, when would we call 911?
911 is anything with persistent, ongoing chest pain, feeling like you can't breathe, you can't get enough oxygen. If you're feeling lightheaded and dizzy, like you feel like you might be passing out, those are all things that either you or a family member should call 911 with immediately.
Ms. Ahmad, what are some of the heart disease risk factors for women, and are these risk factors different for men?
So the way risk factors work is you have the non-modifiable ones, which are the ones you're born with. You can't do anything about those. And you have modifiable risk factors. In men and women, there are some that are exactly the same. So things like age, smoking, high blood pressure, high cholesterol, obesity, diabetes, not being physically active. Mm-hmm. Those are all common among both men and women. But in females specifically, like I said, their risk does go up after menopause because there's a bit of a cardioprotective effect to estrogen. And so once we lose that with menopause, that risk does increase. Also, if you've had preeclampsia or high blood pressure with pregnancy or gestational diabetes, your risk also is increased, and that's specific to women. You also see increases in heart disease in women with depression. Depression,
really?
Mm-hmm, yeah, because of a lot of the stress. Stress is kind of a contributing factor to heart disease. Mm-hmm. And so imagine it this way. Okay, I listed off all of those things. If you're stressed, you're going to eat more. You don't care what you eat. You don't care if you're busy or physically active. You're not going to go to the doctor. So a lot of those things kind of feed the monster, if you will.
Wow.
Yeah.
Ms. Thurnher, at what age can heart disease symptoms show up? And can we ever have heart disease with no symptoms?
Sure. Well, frankly, babies can be born with congenital heart disease. This is more likely structural abnormalities in the heart, and that's why when babies are born, they're going to have a thorough exam and hopefully get referred right away if there are any abnormalities found. If we're talking about coronary artery disease, this is where plaque has built up in the blood vessels in the arteries. That obviously is something that does generally take time. So when you're talking about years of unhealthy lifestyle, some of the risk factors that I see you raising your hand over there, that she has just referred to, we would say even in your 40s, that would still be considered young for coronary artery disease. So you do have time to make better choices.
You really do.
But having said that, yes, you can have coronary artery disease and not know about it. Unfortunately, a lot of people do wait until it's actually interfering with their life and they're having some of those symptoms Dr. DePaola talked about, chest pain, shortness of breath, before they actually go get seen. So this is why we would recommend regular health checkups with your primary care provider so that you can trend your blood pressure over time. You can get your labs checked regularly and see if your cholesterol levels are steadily increasing. This way, if you do see signs of a problem, it can get identified early, and then you can make changes or get on medications for early treatment, which is always going to be better than waiting.
Yes, that is so true, because waiting, I'm only telling you firsthand, waiting will put you in the hospital. Waiting will put you in the cardiac lab when you're basically stripped down to nothing and you're trying to cover up everything God gave you. Waiting will put you at blood pressures of 200 over 160. Waiting will have you weighing 200 plus pounds and not exercising. So these are some things I'm telling you firsthand. Why? Because I lived it. Now, Dr. DePaola, we've talked about the risk factors. What do you suggest as a doctor, ways for us to lower those risk factors for heart disease? I just told everybody about the lifestyle changes.
For sure. One of the things you didn't mention, and I don't know what your history is, but tobacco use is huge. And in this area, it's North Carolina. They don't call it Tobacco Road for a reason. So tobacco is huge in this area. And smoking is just job security for me. And it's so challenging that even in this year, that we don't understand the negative benefits of tobacco use. And I'm talking also equally too with vaping and those sorts of things, because you don't know what chemicals you're inhaling, you're putting it in your body, and it causes just atherosclerosis to form. So that's the big one for me. Obviously, eating a healthy diet, avoiding the drive-through, exercising on a more regular basis, and making sure that you treat the treatables. And that is by going to your doctor regularly. That's allowing them to check your blood pressure. That's allowing them to draw labs to check your cholesterol. Are you or are you not diabetic? Those are huge, because if you don't go to the doctor on a regular basis, you just walk around and, maybe sometimes for some people walking in denial is okay, but then that's ultimately what you end up talking about, where you end up in the cath lab and you're laying there naked trying to cover your bits and pieces. But, you just have to make sure that you make the conscious effort to go in and get checked at least on an annual basis. Now, if you have a strong family history, you might want to engage in getting, a cardiologist a little sooner rather than later, because I personally find that I'm a little bit more aggressive with modifying those risk factors. Okay. Someone who's come in who said, my primary care doctor told me my cholesterol was fine, and I'm like, I think I'd probably be a little bit more aggressive with you when you talk about mom and dad and your two older brothers or sisters already having open heart surgery. So I just tend to be a little bit more aggressive with certain aspects of things. Not that I'm talking, yes, medicines, no, not lifestyle changes. I'm talking about just looking at the bigger picture in a little bit more of an aggressive way so that we can get you on the path of being healthy rather than having to worry down the line.
Dr. DePaola, one quick question before we go into local news. You mentioned vaping. Do you, and now with the way society is going, we might as well go ahead and put cannabis use in there also. Do you see future issues from this later down the line?
I think we're already seeing that, quite frankly. We just know that vaping in general has been just terrible when it comes to overall body health. We were seeing much younger people with no risk factors being horribly affected with COVID when they were just simply vaping. And I know that's kind of getting off topic a little bit, but that, as well as cannabis, which we don't know necessarily what's coming in that cannabis as well, all are toxins to our body and also cause inflammation, causes problems with our coronary arteries and our entire vasculature, which puts you in problems. So I'm a big proponent of staying away from those things as much as you possibly can.
Ladies and gentlemen, we are in the middle of an amazing conversation with Genavie Ahmad, Rachel Thurnher, and Dr. Brenda DePaola on Cape Fear Valley Health's Making Rounds Live. When we return, we're going to get back into this conversation, so make sure you stay close. Cape Fear Valley Health's Making Rounds Live. Thanks for listening.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM.